Hi, everyone. So I thought I would record a short video this week to kind of help distinguish between some of the arteries, nerves, and even the veins in the upper limbs. I think it's important to be able to look at an image and figure out if you're looking at an artery, nerve, just by visually looking at it. But also, I'll talk about some of the anatomy of the terminal branches here and ways to distinguish some of these branches from each other. So kind of right off and I apologize, my hand was kind of shaking the camera while recording this, but you can see me kind of holding back the vein here. So this is the axillary vein. We can appreciate that because of its thinner wall, which you can appreciate here when compared to the axillary artery, which has a much thicker wall. Just obviously looking at these two structures, I can see the discoloration from the contents of the vein, the collapsibility of the vein, and I can appreciate that from the artery, which is here. That can be distinguished from a nerve, right? And again, I apologize, my hand was shaking here, but the nerve is obviously going to be a flat cord-like structure. Even on an image, we can appreciate that this does not have a lumen. And so this is going to be a nervous structure, whereas here's an artery, and then I'm retracting the vein. All right, and I'll kind of just play some of this so you can appreciate me distinguishing these three structures. So that's the nerve or the brachial plexus branches there. And then underneath that, there's the artery, okay? I also want to point out the branches of the brachial plexus. So as you can see here, I'm pointing out that M-like configuration that we see in the brachial plexus formed by these branches. There we go. So we can see that M-like configuration here, right? Here's the medial branch of that M. That is the ulnar nerve. And I'll talk about how that nerve emerges on the posterior aspect of the arm. There's the middle branch of that M. That's the median nerve that goes all the way down the center, across the elbow joint and goes right down the middle of the forearm and wrist. And then on the lateral side, the lateral branch of that M is the musculocutaneous nerve, which is going to pierce the coracobrachialis muscle. Coracobrachialis is a muscle here in the region, and that is pierced by the musculocutaneous nerve. All right, here we can appreciate a slightly different view, similar structures here. So again, we've got that vein. We've got the nerve, right? The median nerve specifically here. And then we've got the medial branch of that M, which is the ulnar nerve. There we go, the ulnar nerve. The median nerve here again, right down the middle. It's going to go across the elbow joint all the way down the middle of the forearm. And then we've got the lateral branch, which is the musculocutaneous. And as you can see, that's the coracobrachialis muscle, which is being pierced by the musculocutaneous nerve. And coracobrachialis is a little bit deep to biceps brachii. So biceps brachii is what I'm holding here. And then deep to that, we can appreciate the coracobrachialis. They are the two heads of biceps brachii. And then brachialis even deeper. Now I'm showing some of the posterior structures here. And it was a little hard to kind of keep my hand stable and point out some of these structures. So I apologize for the shifting frame, but I'm trying to show you the posterior structures here. So the radial nerve, now we're going to have to look posterior or deep to the artery. So here's the artery. Here are those anterior nerves that I was pointing out, that M-like configuration. Deep to that, we're going to see the axillary artery. And then even deeper to that are the two other branches of the brachial plexus. So the radial nerve and then the even shorter axillary nerve. So the axillary nerve is going to go deep and wrap around the shoulder, innervate the deltoid, etc. And so we only see a very short branch of that axillary nerve before it gets buried in the shoulder. So the radial nerve and axillary nerve are part of the posterior cord structures. And so we're going to have to look deep to the artery and some of the anterior structures to find these two branches. So we can see that a little bit better here. That posterior cord branch there. There's the axillary nerve that I'm kind of tugging on. And then the other part of that is going to be the radial nerve. All right, here we've got an entirely different view. We're looking at some of the posterior views or posterior structure. So this is the humerus and arm, and here's the forearm. And here's a posterior view of the elbow joint. So here's the elbow joint, and we can see where the ulnar nerve emerges posteriorly and travels on the medial aspect of the posterior forearm, innervating some of the medial muscles in the forearm itself. So here's the ulnar nerve on the posterior end, or the posterior side here. Okay, and we can also appreciate some of the muscles in the region. So the triceps muscle is going to be the posterior arm muscle. And then some of the extensor muscles on the forearm. So there are some tendons there. All right, so here are the extensors. Here's an artery. All right, here is a tendon compared to an artery. So here's a muscular tendon. Here's a nerve. So here are some different views. Again, we've got a tendon. We can distinguish that tendon from the artery here. And then we can distinguish that artery and tendon from a nerve, right? A nerve is going to be that continuous structure. Here we're looking at, again, a nerve. This is actually on the radial side, so the radial nerve. All right. And because I'm so zoomed in, you can't really appreciate what side I'm showing, so I apologize for that. But this is really for the purposes of being able to decipher between these two types of structures. So here we can really see the difference up close between an artery, which is slightly more tortuous or slightly more windy or bendy, if you will, because of the high pressures in these vessels. And then here's that nerve, which is a straight continuous cord, which we can appreciate side by side here. And then we can obviously tell that from a tendon. Here's the median nerve right along the center of the forearm and wrist here. That's the median nerve. Here we've got the radial nerve and artery on the radial side. And then here will be the ulnar nerve and artery on the ulnar side. And here's what a tendon looks like from a nerve. And here we can see the ulnar structure. So on the medial side, we'll see the ulnar artery, again, more tortuous because of that pressure, compared to the ulnar nerve, which is that straight cord, no lumen. And again, we can really appreciate the difference between these two structures here. We can see that slight discoloration so that we know there's a lumen with contents, which is not appreciated on a nerve, although it's not as patent or as see-through as a vein is. We can definitely see that slight discoloration from the contents of that vessel. All right, here we can see the median nerve right down the middle here. Center of the forearm, median nerve. We can also appreciate the ulnar artery. So on the medial side, we've got the ulnar artery. So here we can see the nerve versus the artery. And I want to point out that while the artery is slightly discolored, we can still appreciate the tortuosity of the vessel, right? We can also appreciate it's slightly more rounded. Nerves are a little bit more flat. And we can see that just by looking at these structures here visually. So there's the artery and a tendon for reference. So again, a tendon is a little bit more easier. You can actually look at the muscular attachment and see that it's a tendon and not another structure. Tendons are also more shiny. Here's a nerve, excuse me, and the radial artery. So the radial artery at the base of the thumb is where we have that radial pulse. So here's the artery again, slightly more tortuous, more rounded, a little bit more see-through in terms of the contents there. So although it's discolored to where it kind of looks the same color as the nerve, because this entire cadaver is slightly discolored, we can still appreciate some obvious differences that will indicate this is an artery, and here's that flatter cord-like nerve. So here are some slightly other views on different cadavers. So we've got a pec major reflected, then we reflect pec minor, and we can appreciate the brachial plexus here in the axilla. We can appreciate the vein again. Now the veins are usually more superficial, and we definitely see that here. The subclavian vein is going to be actually above the artery. Veins are usually above or more superficial when compared to arteries. Is another indicator or helpful factor that we can look out for. So here's the artery, the axillary artery in this region. Remember, the artery is going to change name depending on where it's at. So subclavian, artery, and vein are going to be underneath the clavicle. So here's the clavicle region here. When it gets into the axilla, which is really the armpit region, it's going to change to the axillary vessels. And then as it begins to run alongside the brachia, the arm, it's going to become the brachial artery there. And then here are some of the nerves in the region again. So that's going to be a part of the brachial plexus there. And beyond the M is where we have our terminal branches. There's the biceps brachii, which has been torn. So I'm going to kind of reflect it out of the way. So that's the biceps brachii, the long head there. I'm going to reflect that out of the way. And we can see more clearly the coracobrachialis, which is underneath that biceps brachii long head. And this is being pierced by the musculocutaneous nerve once again. So musculocutaneous there, median going right down the middle, and then ulnar on the medial side. All right, so here again, we've got slightly different views here again. We can appreciate the ulnar nerve coming around the posterior side there again. Here's the ulnar nerve descending into the forearm. Here is the ulnar nerve and ulnar artery together. There we go. So we can see ulnar nerve and artery. Here's a really close view of the artery and the nerve. And again, we can appreciate the slight discoloration and the tortuosity of the artery. And we can also appreciate the absence of those features in the nerve. So there we go. Really close-up shot of an artery and a nerve, which is a little bit harder to differentiate in some of the smaller distal branches. And then here is a tendinous attachment of a muscle. Now, as a bonus here, I'm pointing out pronator teres, which is this small horizontal strip of a muscle. I'm pointing out flexor carpi radialis here, palmaris longus here, and then flexor carpi ulnaris here on the ulnar side. And then I'm pointing out the flexor digitorum superficialis. And again, I apologize for the frame, and flexor digitorum profundus. So superficialis, profundus. And you can see the ulnar vessels in the frame here as well. Ulnar artery and ulnar nerve, which are on the ulnar side. Okay. I really wish I would have kept the camera still. So here's median nerve. Here are the ulnar vessels, which are closer to the ulnar side. Here's the flexor carpi ulnaris. Here's palmaris longus along the center, and then flexor carpi radialis. And again, here's median nerve in the center. And then again, the ulnar vessels are closer to the ulnar side. Here's the thenar eminence, and then we've got the hypothenar eminence as kind of a bonus here. Now, also as a bit of a bonus, I'm pointing out some of the back muscles here. So trapezius, we reflect that away. We can appreciate some of the deeper muscles here, the rhomboids, right? Rhomboid major. Rhomboid minor. So there's rhomboid minor, that smaller muscle above rhomboid major. And this is an upside down view. So just kind of bear that in mind. So we're looking at the back muscles. We're looking at the upper back muscles, and this is an upside down view. So I'm standing at the head of the table here, and we've got rhomboid major and minor on either side. So here's the scapula for reference. Here's, we've reflected the trapezius, which would be covering the rhomboids. And then we can also see the levator scapulae. So levator scapulae right above rhomboid minor. Also, we can see the infraspinatus fossa with the infraspinous muscle here. The infraspinous fossa with infraspinatus muscle, I apologize. As well as the supraspinous fossa with the supraspinatus muscle. And then again, rhomboids there, we can reflect the rhomboids and look at the subscapular fossa, which has the subscapularis muscle. There we go. And then that's the trapezius again on the left. Here's latissimus dorsi along the flank. And then as a final bit here, we can see the deltoid muscle, which is at the shoulder region. And then the teres major and teres minor muscle here, which are underneath the scapula and infraspinatus muscle. All right, so that's kind of it as far as just kind of an anatomical overview of the cadavers and some of the structures. More importantly is looking at the arteries, nerves, veins, and tendons, and being able to distinguish those features visually from an image.